Hi friends, good evening and welcome to my channel. Today we are seeing an important topics on intravenous therapy. Mainly we are seeing type of intravenous solutions. Before seeing that name of the solution, we can see some terms. First one, air embolism. Air embolism means an obstruction caused by a bolus of air that enters the vein through an inadequate intravenous line or from a loose connection or during a tubing change or removal of IV line. So, air is entering into the vein during the time of inadequate intravenous line. That is, if we are not keeping intravenous line properly or from a loose connection or tubing changing time or removal time, that is air is entering into the vein, that may cause air embolism. Next point is catheter embolism. Catheter embolism means an obstruction caused by breakage of the tip of catheter tip during IV line insertion or removal. So mainly in central line and all, during the time of insertion or removal, the catheter tip is damaged. That may cause obstruction. So it may cause catheter embolism. And third point, hypertonic solution. Hypertonic solution means solution that are more concentrated is called a hypertonic solution or have a higher osmolality than body fluid. So in our body fluid it is than our body fluid it is concentrated, that is hypertonics. Due to hypertonicity, what will occur? The movement of water from the cell into the extracellular fluid occur by osmosis, that is by administering hypertonic solutions. And next point is hypotonic solution. Hypotonic solution means solution that are more dilute, that is hypotonic. Dilute solutions are called hypotonic solution or have a low osmolality than body fluid. It's have low osmolality than body fluid. So what we'll do while administering this hypotonic solution, we have to administer slowly to prevent cellular edema. And next point, isotonic solution. Solution have same osmolality as body fluid is called isotonic solution. So it's have same osmolality as body fluid, that is hypotonic solution. And the very next point, infiltration. Infiltration means seepage of IV fluids out of the vein and into the surrounding interstitial space. So the seepage of the fluid may occur, that is leakage of fluid occur from the vein, out of the vein into the surrounding tissues, that is called infiltration. And next point, phlebitis. Phlebitis means an inflammation of the vein. Vein is called phlebitis. Phlebitis means inflammation of the vein. How it occur? It can occur from mechanical or chemical trauma or local infection. So due to the by in our hand or any other cause or local infection may cause phlebitis. Okay, these are all the some important terms. So type of intravenous solutions. Intravenous solutions are isotonic, hypotonic and hypertonic and colloids also. Okay, first one, isotonic solution. Isotonic solution means have same osmolarity as body fluid. They are isotonic. And the examples include 0.9% sodium chloride, that is normal saline, NS, and 5% dextrose in water, D5 in water, and 5% dextrose in 0.225% saline. Okay, and Ringer lactate. These are all isotonic solutions. So N point NS, normal NS, 5% D5 with water, and 5D water in 0.225 saline and Ringer lactate. Okay, and next is hypotonic solutions. Hypotonic solutions means they are more dilute solution and have lower osmolarity than body fluid. They are more diluted and have lower osmolarity. Okay, and so it is hypotonic. We have to administer slowly to prevent cellular edema. Examples include 0.45% sodium chloride, 0.45% sodium chloride, and 0.22% sodium chloride, and 0.33% sodium chloride. These are all hypotonic solutions. And next is hypertonic solutions. Hypertonic solutions means they are more concentrated solution and have high osmolarity than body fluids. They are hypertonic solutions. Examples include 3% sodium chloride or 5% sodium chloride, 10% dextrose in water, 10% dextrose in water, and 5% dextrosin, 0.9% sodium chloride. So 5% dextrosin, 0.9% is hypertonic solution, and 5% dextrosin, 0.45 sodium chloride. 5% dextrosin, 0.45 sodium chloride is hypertonic solution, and 5% dextrosin Ringer lactate solution. 5D in Ringer lactate is hypertonic solution. So these are all the examples for hypertonic solutions. Okay, and next is colloids. Colloids include dextran and albumin. These are all colloids. So the type of intravenous solutions include isotonic, hypotonic, hypertonic and colloids. Examples also it is there. And next important points regarding IV infusion is change the venipuncture site every 48 to 72 hours, and change IV dressing every 72 hours, and change IV tubing every 24 to 72 hours, and do not let an IV bag or bottle of solution hang for more than 24 hours. It should not be hang for more than 24 hours. Related one to question, we can see the nurse is making initial round on the nursing unit to assess the condition of assigned client. The nurse note that the client intravenous site is cool, pale and swollen, and the solution is not infusing. The nurse conclude that which of the following complication has occurred, and the answer options are infection, phlebitis, infiltration and thrombosis. So here the correct answer will come infiltration. Why infiltration means the infiltrated IV may cause IV may occur due to dislodgement of needle from the vein. So due to dislodgement, what will occur? The fluid may be accumulated in the subcutaneous tissue. Once it accumulated in the subcutaneous tissue, there is a swelling. Due to the accumulation of fluid, there is color changes and cool appearance will occur in the skin. So the correct answer is that is called infiltration. So due to that, when the pressure in the tissue exceeds the pressure in the tubing, the fluid will not go to the area and it will automatically stop. As a nurse, what we can do is we have to change the area, we have to change the site and we have to prick it in the another area. So the correct answer is infiltration. Next question. A client had a 1000 ml bag of 5% dextrose and 0.9% sodium chloride hung at 3 p.m. The nurse making rounds at 3:45 p.m. finds that the client is complaining of a pounding headache and is dizzy, is experiencing chill and is apprehensive with an increased pulse rate. The intravenous bag has 400 ml remaining. The nurse should take which action first? First option, call the physician. Second option, slow the IV infusion. Third option, sit the client up in bed. Fourth option, remove the IV catheter. Here the correct answer is slow the IV infusion. So why we have to slow the IV infusion is, here the client may experience circulatory overload. Why? At the time of infusion at 3 p.m. it is 1000 ml infused started with client. By 3:45 p.m. already 600 ml gone and remaining bag have 400 ml remaining by 3:45 p.m. So the client have experienced chills and dyspnea and headache and all due to circulatory, it's a complication. So circulatory overload occurs to the patient. As a nurse, what we should do is we have to immediately slow the IV infusion, and following we have to do what head end of the bed should be elevated to the patient, mainly to improve the breathing pattern, and if necessary patient is having more complication means we have to inform the physician. Next question, nurse is inserting an intravenous line into a client vein. After the initial stick, the nurse continued to advance the catheter if options are the catheter advances easily, second option the vein is distended under the needle, third option the client does not complain of discomfort, fourth option blood return shows in the backflash chamber of the catheter. So here the options correct answer is blood return shows in the backflash chamber of the catheter. Once why means once the catheter is inserting into once the nurse is inserting intravenous line, so what is once the intravenous catheter is entered the lumen of the vein successfully, there is a blood backflash will come, so it indicate the vein is in correct position. Okay, so the nurse should continue the catheterization. Blood return shows in the backflash chamber of the catheter is the correct answer.